Many of you asked me how to do part A of reading. It's very tough for getting it in 15 minutes, right? So I just want you to know how to do the skimming and scanning. Many people think skimming and scanning means reading the paragraph complete and skimming to some precise way and then selecting the keywords and coming back to the content. But that is not the correct way to do it. It is easy to analyze, but before that, let's see how to analyze the paragraph first. So when you see this text A, you know that all four text like text A, text B, text C, and text D is going to be on one topic. So it is about anemia here. Okay. So when you check this text A, there is no topic here, but when I see some important words like defined, symptoms, I can say this is about definition and symptoms. So I will map my mind as definition and symptoms. Okay, so I'm not reading the paragraph. Next, text B. Text B, it's about classification system. So classification in the sense types or classification I can mention. So text B is about types. When you go for text C, it is about the causes, laboratory studies. I'm just pointing out some of the important things. So it's about diagnosis again. So I can map this as causes, laboratory studies, and then diagnosis. I'm writing because just to know for you which all the things I'm doing. And text T is about treatment. Okay, so this is how we will map our mind. Now when you go for this matching question, okay, now I know text A is about definition and symptoms, text B is about classification, text C is about causes, laboratory studies, and diagnosis, and text D is about treatment. I mapped my mind. Now when you see this one, treating patients means it's about D. Next, symptoms is A. Next, methods to identify causes. So causes in the sense I should go for text C. Different types, B. Level of hemoglobin comes under laboratory studies, so C. Red blood cells, C. So I have completed within half a second. So this is how we will go for our matching, but usually we will start with short answers, right? So what should vegan patients with vitamin deficiency anemia be encouraged to add to their diets? So when it comes to adding something to their diets to rule out deficiency, it's about the treatment. So treatment in the sense there will be two keywords in the questions. So this guides you to the paragraph D, right? So one keyword guiding you to the paragraph D, and my keyword is vegan patients. So I will look for this word vegan. Okay, so this is another keyword where routing for your where you have to focus on. So two keywords I'm choosing, one to recognize which paragraph it is, this is skimming, and which word you have to look into it, that is scanning. So I'm going for this vegan patients. I have to look into the paragraph D for vegan patients. The question is, what should vegan patients with vitamin deficiency anemia be encouraged to add to their diets? So when I go for D, don't read the paragraph. Many of you make this mistake. You read the paragraph. I am going to look into the word vegan. I'm going to scan this paragraph for the word vegan. If you see this, I'm not reading, I'm just scanning for. Okay, I got the word vegan diet. So I got the word vegan. So here what you have to add, right? Note the patients who follow vegetarian or vegan diets may struggle to meet B12 requirements. So eating fortified foods, okay, and using supplements should be advised. So what they have to add to their diet? Fortified foods. So I am going to give my answer as fortified foods. Next, if there is a decreased number of young red blood cells, what type of anemia is being dealt with? So I said two keywords it will be. So type is where it is for B. So classification we have seen it is from B. Now I have to look into the decreased number of young red blood cells. In B paragraph, I have to look for young red blood cells. This is some kind of derived questions. Derived question means indirect questions. Okay. So I need to look for something decreased number of young red blood cells. So going for text B. Okay, don't read it again, I'm telling, just look for the word young red blood cells. There is here young red blood cells. This is also called reticulocytes, but here they have given increased number. Okay, but the question is, what is decreased number called? Okay, so if I read the line, I didn't get decreased. So I am going to read this line. Normocytic anemias are further broken up into whether or not there is an increased number of young red blood cells. Whether or not, in the sense the presence they are telling. Present or not. Okay. Depends upon the presence of young red blood cells. This will be classified. So how I can go for that? Only increased is given. Check in the picture. They are talking about normocytic. So normocytic with the presence of reticulocytes, whether it is high or low, you are going to decide. So if it is increased, it is going to be high reticulocytes. If it is decreased, then it will be normal or low reticulocytes. So with the line, when it is not direct answer, I am going to use something like derivative. So with this line, I am going for this to get the derivative answer. So normocytic will be divided into high and low with the presence of young red blood cells, that is also called reticulocytes. So the question is about decreased number. Decreased number means I have to go for normal or low reticulocytes. So such kind of questions are indirect. Okay. So it is normal or low reticulocytes. Now, how will a patient's breathing sound when experiencing a significant reduction of oxygen? So something you are experiencing, something you are showing. So this breathing sounds and experiencing comes under symptoms. Symptoms in the sense it is text A. So they are talking about breathing sound. So this keyword leads to text A, and they are talking about breathing sound. So I will scan for breathing, the word breathing. So how means what kind of, which what kind of breathing sound you are experiencing, that is what they are asking for. Now let's go for text A. So don't read it again, I'm telling you. Just go for the word breathing. So I found out the word breathing. So what kind of breathing you have? Difficult or labored. That's it. And the word reduction of oxygen is given as hypoxia. So I'm going for answered as difficult or labored. Any one or two you are mentioning, then the answer is correct. Now, a male with anemia must have less than what percentage of red blood cells? So the question is about percentage of red blood cells. Okay, this is your first keyword. Red blood cells will be in text C. So I'm skimming to text C, and what you have to look into male candidate, which is less than. Less than is your another keyword where I have to look into it. Okay, so you have to go for percentage of red blood cells, and second thing is less than for male candidate. So your word of looking is less than. Now, okay, could you find out the word less than? Less than is here as well as here, but which one is for percentage? This is for percentage. Less than 45% is what your answer, and this is for male candidate. Okay, so I'm going for answer 45%. Okay, next, what is an increase in the number of reticulocytes an indication of? So this is about the indication of. Okay, and it is also about reticulocytes. If you remember, reticulocytes we have seen in text B. So I have to look into the look into the paragraph, that is B, and I need to scan for indication of. Okay, so now I'm going for text B. Okay, this is skimming and the scanning part is indication of. Okay, reticulocytes we have seen here, right? So if you see this reticulocytes, which is an indication of what? If the bone marrow is working properly or not. So bone marrow is working properly or not is what your answer. So your question is increase in number of reticulocyte, indication of. Increase in number of young red blood cells is otherwise called reticulocytes, which is an indication of bone marrow is working properly. So I am writing like bone marrow is working properly. What reduces the amount of red blood cells in some patients? So it is about reducing. Okay, this is the word you scan to. Amount of red blood cells, where we have seen red blood cells is about C. So I need to check amount of red blood cells reduces. If you have some few such words, please mark it for your understanding. This is for some patients, few patients, or something they have provided like this. It is important. Sometimes this word, most, some, however, such words are very important. So this guides you skim to text C, and this is about reducing. Okay, so when I go for text C, there is red blood cell amount. So red blood cell amount, I have to look for lowering. So lowering in the sense lowering or reducing something, I need to check that. Then the synonyms are like less than, and you have lower, no reduction. Okay, so when you found such words, so your question is about reduces the amount of red blood cells. So here lower red blood cell amount. So this is like synonymous word, lower red blood cell amount. During when? Monthly menstrual cycle. In some patients means male and female given. So some patients is female. I can take it as female or considered as some patients instead of telling both of them. So where you will get reduced amount of red blood cell amount, those who have monthly menstrual cycle. So mention here as menstrual cycle. Now what should be treated? Treated is for text D. After identifying the cause. So it's about identifying the cause. So scanning part. Okay, now I have skimmed to text D, and then scanning part is about identifying. So I'm going for text D. In text D, I could see the identify word. Identify and treat. So after identifying, treat what? Any complications. Okay, so the answer is any complication. Now, how are the different types of anemia most commonly distinguished? It is about types of anemia. Types of anemia means it is text B. Okay, now I have to check more. Anemia is general topic. Don't choose keyword as general topic. So I'm not because the whole text is about anemia. Okay, so now I'm going for most commonly distinguished. I will scan for the word most commonly used. Okay, this is text D. Sorry, text B. There are many classification systems to differentiate anemias. The most commonly used is based on the size of red blood cells. So here is your keyword, most commonly used. Most commonly differentiated is based on the size of red blood cells. So I will mark like how are the different types of anemia most commonly distinguished. So based on the based on the size of red blood cells. Okay, so now my answer is completed. Now next time, question 15 to 20, how I am going to complete. Okay, Now anemia caused by dash should be treated with blood transfusion. Again, should be treated. Should be treated means treated, I should check in D, with a blood transfusion. So in text D, I have to look for the word blood transfusion. So blood transfusion, what kind of anemia? What kind of anemia should be treated with blood transfusion? Okay. So what kind of anemia should be treated with blood transfusion? In the sense, I am going for text D. Okay. So patient has anemia because of blood loss, give a blood transfusion. So I found out the word blood transfusion, where what kind of anemia it is because of blood loss. So this is the scanning word which I have looked for, and it is about blood loss. So caused by what? Blood loss. Next, patient suffering from hypoxia. Suffering from is, we already saw the reduction of oxygen is from text A. Suffering from two things, hypoxia and chest pain. Or likely to also have a DAS. So patients suffering from hypoxia and chest pain are likely to also have a. So here you have a content like two things. The patient should have hypoxia and chest pain. So two things, but also they should have one more. Also have a. So it means one more disease condition they have. So what kind of disease condition it is? So I skimmed to text A. Now I have to find out the answer where it is. One more disease condition. Okay. If you go to the text A, okay, there is the word hypoxia which I already marked. So I need to look for the word chest pain. So there is a chest pain here. So those who have hypoxia, these all common symptoms of those who have hypoxia. So you have weakness, headache, everything. So those who have hypoxia as well as chest pain also has disease of arteries. Okay, so my answer lies here. Okay. So it's about disease of arteries. Okay. If DAS is functioning properly, high reticulocyte anemia is likely to be present. So high reticulocyte anemia we know already. High reticulocyte anemia we already said, we already saw this, right? We already made this question before with the bone marrow, right? So if you have remember this question, it is about reticulocytes. So high reticulocytes is in the text B. And what is functioning properly? When there is a high reticulocyte or increased amount of young red blood cells is likely to be present. We already saw this question. I have analyzed the question answer as bone marrow, but in case if you have you couldn't understand it properly, you can go for text B. Here, increased number of young red blood cells, which is also called reticulocytes, which we derived as high reticulocytes, okay, which is an indication of what? If the bone marrow is working properly. This working word is given as functioning. So this is again a synonymous question. So we have already given the answer as bone marrow. So just for your understanding, so this kind of questions are synonymous questions. Now, if number of tests may be necessary to diagnose. You remember diagnose we have seen in text C. So this is for skimming pattern. So diagnose goes for C. Due to difficulties involved in measuring something is what your question is about. So it is about diagnosis. Diagnosis goes for text C, and what it measures, that's what we have to look into it. So I'm going for text C and I want to look for the word measuring. question is about difficulty in measuring. So I am just underlining the word measuring. So here is the word difficult. What is very difficult to measure? It is about red blood cell mass. So patients with anemia a number of tests may be necessary to diagnose anemia due to the difficulties involved in measuring. So measuring is about red blood cell mass. Okay. Now next question. Patients with anemia caused by dash should be instructed to adjust their diet. This also we have already saw. Adjust their diet is about the treatment, and then it caused by what should be instructed. So some kind of deficiency when they have, you are going to adjust their diet or take supplements. So this question also we have already seen, but anyway, let me go through the content. Okay, a patient with anemia caused by vitamin deficiency should be advised is given as instructed. Okay, instructed to increase their intake of folic acid, and also vegetarian diets or vegan diets, they need to increase eating fortified foods and using supplements. So here, caused by what? Vitamin deficiency. So I am giving the word deficiency. Now, when identifying the type of etiology, so that I am going to mark the word which I am looking for as etiology of the patient should be considered in addition to laboratory studies. Here identifying means it is about the causes, what you are going to get. So it is in the text C, and this is the word I marked. So when you are going to identify the etiology, you have something of the patient should be considered. Some attributes of patient is what you are going to consider. So now let's go for text C. Okay. While there are many different causes of anemia, laboratory studies is there. Laboratory studies and unique features of the patient. So what of the patient? Unique features. Laboratory studies is already there in your question. So the answer is unique features of the patient can be used to help differentiate between various etiologies. This is the word I looked into. Okay. So now, if you have seen this, so I have to give here unique features. Okay, so if you have seen the question types, there are few questions like functioning properly, which is a synonymous question, and then this kind of question is indirect question, and then reduces was given as lowered synonymous question. So two synonymous question and one indirect question was given in your OET paper. So mostly this is how they follow the questions. Okay, everything will be direct for you. 2-3 questions will be derivative, or we can say like indirect questions, and 1 or 2 will be synonymous question. So out of 20 you will be able to get 18 easily if you concentrate and do it. Okay, hope this helps.